In the event of a radiation disaster, there is no such thing as being too prepared. That's why on June 22, 2018, 10 healthcare organizations and government agencies came together for the Philly Special RadEx, a day-long, full-scale radiological disaster exercise. The Philly Special RadEx simulated the response to a distant radiation disaster with mass casualties. The objectives? To evaluate the hospitals and partner agencies' ability to triage and treat a surge of radiation-injured patients. To evaluate and strengthen coordination and communication between responding agencies. And to provide incident management team members an opportunity to practice their critical roles in a simulated environment. The exercise began at the Philadelphia International Airport, where a patient reception area was established. Here, emergency medical personnel from the Southeastern Pennsylvania Surge Medical Assistance Response Team and the Department of Veterans Affairs simulated triage and entering patient information into a regional tracking database. A centralized command center coordinated efforts between federal, state, and local response organizations, as well as the transfer of patients to the appropriate hospital. Following triage at the patient reception area, patients were then transported to either Children's Hospital of Philadelphia or Hospital of the University of Pennsylvania for treatment. During the exercise, Children's Hospital of Philadelphia evaluated its new Radiation Injury Treatment Network, or RITN, response plan, which surged patients into its outpatient oncology day hospital. After being admitted into the outpatient oncology day hospital through the standard registration practices, patients received follow-up triage to rule out misdiagnosis or worsened conditions, followed by bed assignment and any necessary treatment. Oncology, blood, and marrow transplant care providers set up an incident command post to aid with patient tracking, bed availability, patient and caregiver flow, resource needs, and role assignments. Acting as the area commander, a flow facilitator led the response in the day hospital and communicated with the incident management team in the Children's Hospital of Philadelphia's command center. Children's Hospital of Philadelphia's incident management team supported the response by maintaining hospital operations, coordinating logistics and external communications, and by solving challenges as they arose. Throughout the Children's Hospital exercise, a few unanticipated challenges arose, such as family reunification questions, internal rumor control, coordination with media, and patient placement for those requiring inpatient admission, as well as outpatient care. One of the biggest challenges? How to create a sustained support mechanism for patients who require outpatient care but lack access to basic necessities, such as housing, clothing, local transportation, and food. These challenges were compounded for patients who were unaccompanied minors. At the Hospital of the University of Pennsylvania, patients passed through a portal monitor that detects radioactive material to screen for radiological contaminations. The monitor confirmed all patients were contamination-free, with the exception of one. The person who triggered the alarm was intentionally placed to test the team's response. The patient provided medical staff with documentation that showed she had been receiving nuclear medicine treatments for cancer. While all patients transported by the National Disaster Medical System are expected to be free of radiological contamination, screening is essential to quell public and employee fears. After their screening, patients were brought to the White Courtyard, where emergency department and oncology medical staff work together to provide triage and treatment decisions. Like Children's Hospital of Philadelphia, the Hospital of the University of Pennsylvania activated its command center to manage patient admissions, bed capacity and patient placement, and to coordinate requests for resources and information. The hospital also activated its Enterprise Coordination Center, which managed and resolved unmet needs and coordinated regionally with the Southeastern Pennsylvania Healthcare Coalition and the Hospital of the University of Pennsylvania Systems Leadership. The Philly Special RadEx provided a unique opportunity to test both inpatient and outpatient care, as well as the complex coordination between a large group of hospitals and government agencies. Although inpatient and outpatient care are connected in the continuum of care, outpatient care is not typically used during a disaster situation. The exercise also supported the partnership of oncology, blood and marrow transplant specialists with the hospital's emergency preparedness efforts. Traditionally, this has been a role for the emergency department clinicians, and these two teams have not participated in disaster exercises. This exercise provided a valuable opportunity for all of the participants to work together to leverage strengths, support each other, and collaborate further to be better prepared for whatever is thrown their way.